Hi, Stefan Hartman here, Iron Direct Primary Care, bringing you my lecture on You Are Not Lactose Intolerant, Raw Dairy versus Pasteurized Dairy. Now, this isn't going to be a historical lesson. We're going to get into that another time about the untold story of milk. It's going to be more specific towards, are you really lactose intolerant, or are you something else? Lactulose intolerant. You've probably been told this, or you know a friend who's been told this. You know, everyone has a friend who has a lactose intolerance. What is lactose and what is lactulose? We're going to get into that, okay? Essentially, in milk, raw milk, lactulose doesn't exist, okay? Lactulose only forms through the high heating of milk, the pasteurization process. And the higher you heat up milk, the more lactulose that is formed. Now, lactulose, what is that? You see this bottle here, that is a prescription medication. It's an osmotic laxative. So what it does, you prescribe it to constipated individuals. It pulls water into the colon, so you have diarrhea. And it's actually used sometimes in the hospital for patients with hepatic encephalopathy. It really draws out ammonia. It draws out a lot of things, including nutrients. Potassium deficiency is very common with use of lactulose. So if you're using lactulose in the hospital, you would always want to prescribe potassium so your patients don't become hypokalemic. So there's a lot of issues with lactulose use. Now let's talk a little bit more about this thing in milk, this lactulose. Milk pasteurization explained. So what is ultra high pasteurization? That's up to 280 degrees Fahrenheit. Now, lactulose is produced industrially by isomerization of lactose, blah, 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 during heating process to more than 70 degrees Celsius. So 70 degrees Celsius is way higher than the necessary temperature to form lactulose in milk. Ultra high heat milk, which is found commonly in any Walmart, Publix, that's 137 Celsius, almost twice as much heating. So you can imagine how much lactulose is formed there. Well, we don't need to imagine, we can calculate it. Here we go. Process control, the effectiveness of milk and heat studies is from the Encyclopedia of Dairy Sciences. Ultra high temperature milk generally has a lactulose content of 500 milligrams, while pasteurized milk has less than 100 milligrams, right? So there's a big difference between just pasteurization and even ultra high temperature pasteurization process, and they both form lactulose. Now, what's the dosage that I would prescribe for, say, a constipated child? Probably less than 30 ml, so less than 20 grams of lactulose. That's enough to produce a diarrheal effect. Now, drinking maybe a cup or two of milk could equate to potentially 1 or 2 grams of lactulose. So you're treating your children with a low dose diarrheal agent when giving them ultra high temperature treated milk, which is really the only milk available in the stores. Okay, let's get into what about bacteria in raw milk? Well, let's meet some of these beneficial enzymes. Lactoperoxidase. It's in all living tissues, plants, animals, and it's involved in innate immunity to infection. Let's see. Goat milk contains 10 times more lactoperoxidase than human milk. That's interesting. So effective is lactoperoxidase at killing pathogens that officials in other countries are exploring the possibilities of using lactoperoxidase for ensuring the safety of other foods, and even as an alternative to pasteurization. Mind-blowing, right? Lactoferrin. Let's meet another little enzyme called lactoferrin. Mind you, both of these enzymes completely destroyed by the pasteurization process. Okay, they're very delicate little molecules. The second major antimicrobial enzyme in milk is lactoferrin, which works by stealing iron away from pathogens and carrying it through the gut wall into the bloodstream. Thus, this enzyme does a double duty, killing off a wide range of iron-loving pathogens while helping the infant to absorb all the iron contained in milk. This is cow milk that this is referring to. This is from the untold story of milk. We know it's very commonly, they teach us this in training, that if a child is just drinking milk, that they'll get iron deficiency anemia. And there's little pictures that are cut off here at the end of a pale child's foot and fingers. This is a child who was just drinking milk, mind you, pasteurized milk, and developed an iron deficiency anemia. All right, this is, I suspect, related to the pasteurization process of milk that destroys the lactoferrin and thus destroys the ability of lactoferrin, or the existence of lactoferrin in milk. Now, lactoferrin treats opportunistic infections. It's fascinating here. In a healthy individual, iron is largely intracellular, sequestering with ferritin as a cofactor of heme complexed with hemoglobin with erythrocytes. Any extracellular free iron is rapidly bound to circulating transferrin. Okay, so transferrin is pretty important. Bacterial pathogens can acquire iron through receptor-mediated recognition of transferrin, lactoferrin, hemoxin, and other complexes. Alternatively, secreted siderophores can remove iron from transferrin, lactoferrin, and ferritin. So bacteria have a very interesting relationship to iron. And lactoferrin is that checks and balance towards bacteria, right? By starving these bacteria of iron, it starves the bacteria, and thus the bacteria cannot cause pathology in the milk and in the human. Lactoferin's anti-cancer properties. Yes, I'm actually enrolled in a study right now to use lactoferrin and another molecule that I'm not going to mention for getting banned here to treat cancer. Yes. So despite recent advances in cancer therapy, current treatments, including radiotherapy, chemotherapy, and immunotherapy, although beneficial, present attendant side effects and long-term sequelae. So what are they talking about here? Recently, the use of nutraceuticals as natural compounds corroborating anti-cancer standard therapy is emerging as a promising tool for the relative abundance, bioavailability, safety, and low-cost effectiveness and immunocompatibility with the host. In this review, we outlined the anti-cancer properties of lactoferrin, an iron-binding glycoprotein of the innate immune defense. Lactoferrin shows high bioavailability after oral administration, high selectivity toward cancer cells, and a wide range of molecular target controlling tumor proliferation, survival, migration, invasion, and metastasization. Of note, lactoferrin is able to promote or inhibit cell proliferation and migration depending on whether it acts upon normal or cancerous cells, respectively. Importantly, lactoferrin administration is highly tolerated. It does not present significant adverse effects. Moreover, lactoferrin can prevent development or inhibit cancer growth by boosting adaptive immune response. Finally, lactoferrin was recently found to be a ideal carrier for chemotherapeutics, even for the treatment of brain tumors, due to its ability to cross the blood-brain barrier, thus globally appearing as a promising tool for cancer prevention and treatment, especially in combination therapies. So amazing, but lactoferrin has been destroyed in the pasteurization process, and it has been absent from the diet of Americans for perhaps since 100 years. I believe this whole pasteurization process really started up in the 30s. And what do we see? Cancer is rampant. Maybe a correlation here, don't we think? But lactoferrin is cheap. It's found naturally in raw milk. So, do you think we're going to get any large trials on this? Some randomized placebo-controlled trials to look at the benefits of lactoferrin on human physiology? No, we're not. Gut health. Pasteurized milk is well known to cause gut issues. We all know a person who has gut issues from milk, right? Raw milk, though, heals leaky gut. It prevents small intestinal bacterial overgrowth and small intestinal fungal overgrowth, all right, through its ability to inhibit pathological iron-loving bacteria and fungi. Let's look at more. Effect of the quality of milk on Maillard reaction and protein oxidation during preparation of cow and buffalo milk. Lactulose itself is absent in raw milk, but heating of milk results into conversion of lactose to lactulose. So we know this destroys one enzyme, but let's look a little bit more at proteins, right? Oxidative damage to proteins in the pasteurization process. And yes, this is an example of a milk pasteurization facility, right? Milk enters, heating, cooling, milk leaves. And then we have basically this dead milk. It's inactive. There's no life in it, right? Proteins are a major target for biological oxidants as a result of their abundance and high rate constraints for reaction with many species. So As most protein damage is non-repairable, oxidation can have deleterious effect, including loss or sometimes gain of function, e.g. enzymatic, structural, or signaling, fragmentation, aggregation, unfolding, altered interactions with other proteins, and modified turnover. In some cases, these altered materials are poorly degraded and accumulate within cells. This may contribute to multiple human pathologies. I think there's a lot of oxidative stress going on in the human population. Heart disease is oxidative stress. Cancer, it's oxidative stress. What is causing all this oxidative stress in people? Why do we have all this inflammation, joint pain, depression, brain fog, all this oxidative stress going on in the body? What is this? Maillard reaction, more. Effect of heat treatment. Loss of lysine, right? So lysine, which prevents cold sores, aids in muscle and collagen growth, reduces anxiety, and aids in calcium retention for bone strength, is destroyed with high heat of milk. The lysine loss by the Maillard reaction increases with the severity of heat treatment, okay? Heat-induced inactivation of major enzymes. These are all the enzymes that are destroyed with temperature. And remember, the ultra-high temperature milk is 130 degrees Celsius. You could already see destruction of all these enzymes at low heat, right? In the normal pasteurization process. All these enzymes, gone. They all have essential roles. We could spend hours, semesters, talking about all these essential life-saving and life-promoting enzymes destroyed through the pasteurization process. And we're going to conclude this by once again ramming it home, because I think understanding lactose and lactulose is probably easiest for everyone. If you can just get this message across to people instead of like talking about enzymes, which no one really understands. Everyone knows what lactulose is. You've probably given it to your kid or someone for constipation. Gives them diarrhea, gives them the runs. Lactose? Everyone's heard of lactose. Oh, you have lactose intolerance. My doctor, my GI told me I can't have milk. I have to drink lactose-free milk. Really? Is that really the case? Or are you just sensitive to lactulose, the diarrheal agent? Lactulose is not found in raw milk. Conclusion, raw milk from grass-fed cows is full of nutrients, intact proteins, life-saving enzymes, and checks and balances against the formation of pathogens. Lactulose is not present in milk unless it is pasteurized. The intensity of the heat increases the presence of lactulose, right? Lactulose is a prescription-only medication used as an osmotic laxative. Causes diarrhea. It's prescription only because it's very dangerous. You could give your patient hypokalemia, which can cause death, right? I mean, this is at higher doses of lactulose, obviously. I think just a bit of ultra-high temperature milk won't cause death, but it probably is not good for you. It can be inferred that the widely used term lactose intolerance is a misnomer, where lactulose intolerance is probably more appropriate. I hope you all enjoyed this lecture. I'm going to be talking more about milk, the history of milk, how we got into this situation where everybody, every doctor, every medical professional thinks that raw milk is dangerous. They think it's gross or something. When I describe raw milk to people, they have a revulsion to it. I don't understand this. Raw milk is probably the best tasting thing on earth. It's we evolved with milk, right? We owe most of our civilization to milk. Right? This is how we survived as human beings. Our herds provided milk, especially Europeans, but Africans as well. There's still African tribes who survive off of milk. You know, the Maasai, they drink the blood milk, right? They mix the cow's blood with the milk. So it's integral to pretty much every culture. From Asian cultures, European cultures, African cultures, there's not a culture really that didn't evolve with raw milk. Thank you for joining this lecture.